We've talked about how oral appliance therapy can be used to treat snoring and sleep apnea with our expert Center for Sleep Apnea and TMJ. These treatments are especially important to consider as we get closer to the end of the year. So many people need to use up their insurance benefits, so Dr. Wilson is back with us, along with Sarah, a licensed practical nurse, to discuss more about these treatments and how they can help. Thank you so much for joining us.
Thanks for having us.
Yeah, so Dr. Wilson, I'd like to start with you because millions of Americans are suffering from sleep issues and sleep apnea, but they pretty much think this is just the way that life is, and they don't realize all of their options.
So true. The most commonly prescribed treatment is CPAP therapy, which is fantastic if it works for you. But for a lot of people, unfortunately, it doesn't. So there is an easy alternative, oral appliance therapy. It's physician recommended, and your medical insurance will most likely pay for it. Most medical insurances have benefits.
Okay, so all of these people in our community that are utilizing a CPAP machine, they're now tuning in and are listening to everything that you're saying because, you know, this is a huge weight lifted off of people's shoulders.
So I have a lot of people that they love their CPAP, but maybe they want something that's easier to travel with or go camping with, things like that, that don't require electricity. So this is a great alternative. For the people who just simply cannot tolerate CPAP therapy, this is a true lifesaver.
Yeah, so what are some of the other benefits of this device?
Easy to travel with, doesn't require any electricity. You can tuck it in your pocket and go. You can have multiple appliances, so you can have one at your vacation home, one in your motorhome, one at your regular residence, and insurance pays for it.
Yeah. Okay, so we're seeing some photos here, and you know, a lot of people call this sleep divorce, and so many marriages are suffering from it. Sarah, I want to bring you into the conversation because you're a licensed practical nurse, but you also know this very, very well. Your husband was on a CPAP machine for about 10 years.
Correct, yes.
Yeah. So talk to me a little bit about the journey and the transition and how it was better for him.
Yeah, so the journey was interesting. It's a struggle at first because you know you need to treat your sleep apnea because it just keeps going and going and going with other health effects negatively, like blood pressure, diabetes, cardiovascular issues. But he did wear the CPAP because he essentially had to. He knew what the effects were if he didn't. And learning of these appliances were life-changing, and the transition was surprisingly very, very smooth. Because at first it's like, an appliance can do this? And then honestly, instantly, it's amazing that how it works. And that we didn't know about it sooner.
Yeah.
That's just the biggest disappointment, is we didn't know it existed sooner.
Yeah, and I keep hearing this from people and from patients that they wish they knew about this sooner. Okay, there's something else really unique about this. Not only is it going to help with your loved one or yourself sleeping throughout the night without a huge CPAP machine, but you have a history of working in diabetes with patient care and also education. And so, like you mentioned, everything is connected. And so when one thing might not be working correctly, that's going to affect the entire body in many different ways, detrimentally if one thing isn't working correctly. So talk to me a little bit about the correlation and what you've seen.
Oh, absolutely. So unfortunately, untreated sleep apnea, in a way, it alters your genetic makeup. If you're stopping breathing, the carbon dioxide levels in your blood, essentially, you're deprived. So the increased risk for type 2 diabetes, obesity, cardiovascular issues, heart attacks, strokes, high cholesterol are there. And unfortunately, not having your sleep apnea untreated is just a snowball effect.
Yeah, so talk us through what we're seeing right here, the obstructive sleep apnea.
Correct, so the photo that you're seeing is giving you a visual of obstructive sleep apnea and what occurs during the night. And essentially, the back part of the palate is where the soft palate tongue collapses and blocks your whole entire airway. And that's technically considered an apnea. And so a lot of times people who are experiencing this aren't in real time actively realizing it. You may wake up in the morning with a headache, a little foggy, drowsy. It's usually the loved one, their significant other, that is the one hearing it, who's also affected. But the physical aspects of it they're very scary, dangerous, but also at the same time highly capable to be treated. And unfortunately, the people that are trying so hard to control their diabetes, and I saw it in that world that I worked in, they're doing everything that they can, lifestyle, diet changes, and They just are not getting good blood sugar control, their weight gain, and they're very, very frustrated. Tried CPAP, wasn't able to tolerate it essentially, or newly diagnosed and had no idea what direction to go to. And so fast forward months later, because we would make referrals and make sure that they would kind of get lined up, and people that had their sleep apnea treated, shocking that their weight essentially is stable or their weight loss journey would continue, but their blood sugars were so controlled that it's such a good feeling.
That's incredible.
Yeah.
And it's fascinating. And so I'm so glad you're here to talk about this issue, because there are so many people that are dealing with diabetes and other health-related issues and probably never made the connector that it could be possibly related to their sleep patterns.
Mm-hmm. Yeah, and women especially, it's tough because we're always on the go. And taking care of kids, people with families, but also just we're so busy, and a lot of it's, oh, I have a migraine, or you kind of just relate it to your lifestyle. When underlying cause of sleep apnea, it's the most underdiagnosed population, I feel personally.
Wow, Sarah, that is incredible information. Thank you for
you're welcome.
Shedding light on that for everyone here in our community. So, Dr. Wilson, you know, if people want more information, you have 2 books out. Tell us what people can find out in those books.
Well, the books are written for the average person, so all the medical and technical stuff is really brought down to an easy to understand level. We cover what sleep apnea is, why it should be treated, what treatment options are. There's even a special chapter on COVID in there. There's DIY, and there's my personal story on how I became involved with sleep apnea as well, and it involves my kids, and it's so it's pretty interesting.
Yeah.
Cover to cover. I've had very good feedback from people that have read it.
That is fantastic. Okay, if people want more information, you know, we do have to mention that you do work with several different insurance companies, and we are nearing the end of the year, and so now is the time to make the call and do this, because you want to utilize that insurance.
Yes, so many people are either really close to meeting their deductible or they've met their deductible, and their treatment can cost little to nothing out of pocket. So the time to act is now. Do not wait. The end of the year is going to be here before you know it, and then you're going to miss out. So please act now for your own benefit.
Yeah. Thank you so much. Great information. We appreciate it.
Thank you for having us.
Yeah.